Every year, over 1 million people lose their lives to liver cirrhosis, a silent but deadly disease that often goes unnoticed until it's too late. Your liver, the body's largest internal organ, is a powerhouse that filters toxins, metabolizes nutrients, and produces essential proteins to keep you alive. But when it's under constant attack, from alcohol, viral infections like hepatitis, fatty liver disease, autoimmune disorders, or even genetics, it begins to scar. This scarring process, known as cirrhosis, slowly replaces healthy liver tissue with hardened, non-functional fibrotic tissue. Over time, the liver struggles to perform its vital functions, leading to life-threatening complications like liver failure, internal bleeding, and even liver cancer. The most terrifying part? Cirrhosis doesn't show clear symptoms in its early stages, making it one of the most dangerous yet preventable diseases. However, if caught early, lifestyle changes, medical intervention, and proper treatment can slow down, stop, or even reverse liver damage before it reaches a critical state. In this video, we'll uncover 12 early warning signs of liver cirrhosis. Symptoms that may seem minor but could indicate that your liver is dying. Stay with us until the end, because knowing these signs could save your life or the life of someone you love. 1. Fatigue and weakness. Fatigue and weakness are among the earliest and most overlooked warning signs of liver cirrhosis, yet they are often mistaken for everyday exhaustion, aging, or even unrelated health conditions like anemia, thyroid disorders, or chronic fatigue syndrome. The liver plays a central role in energy metabolism, as it is responsible for breaking down carbohydrates, proteins, and fats to regulate blood sugar levels and fuel the body. One of its key functions is to store glycogen, a form of glucose that can be quickly released into the bloodstream when energy is needed. However, when the liver is damaged by cirrhosis, this function becomes impaired, leading to energy imbalances, low blood sugar levels, and persistent fatigue. Additionally, liver dysfunction affects protein metabolism, reducing the production of essential proteins and enzymes needed for muscle function, recovery, and overall energy production. As a result, individuals with early-stage cirrhosis may feel chronically drained, sluggish, and weak even after a full night's sleep or periods of rest. Another major contributor to this relentless fatigue is the accumulation of toxins in the bloodstream. Under normal circumstances, the liver acts as the body's natural detoxifier, filtering out harmful substances and preventing them from circulating in the blood. However, as liver function deteriorates, it becomes less effective at removing toxins, leading to a buildup of ammonia and other waste products. This not only affects brain function, causing mental fog, confusion, and difficulty concentrating, but also contributes to an overwhelming sense of fatigue. Unlike normal tiredness, which can be alleviated with rest, sleep, or a change in routine, the exhaustion associated with liver cirrhosis is deep, persistent, and unrelenting. Many individuals describe it as an all-encompassing sense of physical and mental exhaustion that interferes with their daily activities and reduces their overall quality of life. Unfortunately, because fatigue is such a non-specific symptom, it is frequently misdiagnosed or dismissed as a result of stress, depression, iron deficiency, or hormonal imbalances. This can lead to a dangerous delay in identifying the true underlying cause. Liver dysfunction, if chronic fatigue is accompanied by other subtle warning signs, such as unexplained weight loss, nausea, jaundice, or swelling in the legs and abdomen, it is crucial to seek medical attention and undergo liver function tests. Early detection of cirrhosis allows for lifestyle modifications, dietary changes, and medical interventions that can help slow the progression of liver damage. If you have been experiencing constant exhaustion with no clear explanation, do not ignore it. It could be your liver's way of signaling for help, and acting early could make a significant difference in your health and longevity. 2. Unexplained weight loss. Unexplained weight loss and muscle wasting are significant early warning signs of liver cirrhosis, often developing gradually as liver function deteriorates. The liver plays a crucial role in protein metabolism and digestion, regulating the breakdown, synthesis, and storage of proteins essential for muscle maintenance, tissue repair, and overall body function. When the liver is healthy, it efficiently processes dietary proteins into amino acids, which are then used to build and repair muscle tissues. However, when cirrhosis begins to develop, the liver's ability to metabolize proteins declines, leading to muscle breakdown, malnutrition, and unintended weight loss. Since the liver also plays a key role in the digestion and absorption of nutrients, cirrhosis disrupts the body's ability to properly absorb proteins, fats, and vitamins, further exacerbating nutritional deficiencies. As the disease progresses, the body enters a catabolic state, meaning it starts breaking down its own muscle and fat stores to compensate for the lack of proper nutrient absorption. This process results in muscle wasting, weakness, and a frail appearance, particularly noticeable in the arms, legs, and face, while fluid retention in the abdomen, ascites, may mask overall weight loss, making it harder to detect in some individuals. Another critical factor contributing to malnutrition in cirrhosis is the impact of liver dysfunction on appetite and digestion. Many people with cirrhosis experience nausea, loss of appetite, and a feeling of fullness even after eating small amounts of food due to the buildup of toxins in the bloodstream and the presence of fluid in the abdominal cavity. This often leads to reduced food intake, worsening malnutrition, and accelerating muscle wasting. Additionally, cirrhosis affects the production of bile, a substance needed to digest fats and absorb fat-soluble vitamins like A, D, E, and K. A lack of these essential nutrients further contributes to weakness, fragile bones, and immune system suppression, making individuals more susceptible to infections and other complications. Since muscle loss can progress silently in the early stages, many people may not realize they are losing muscle mass until they experience weakness, difficulty with daily activities, or unintentional weight loss. Unfortunately, unexplained weight loss is often misattributed to factors like aging, stress, or metabolic conditions, delaying proper diagnosis and treatment. If you or someone you know is losing weight without trying, noticing decreased muscle strength, or experiencing persistent fatigue and loss of appetite, it is crucial to seek medical attention immediately. Identifying liver dysfunction early allows for nutritional intervention, high-protein diets, and medical treatments that can help slow muscle loss and improve overall health. Ignoring this warning sign could lead to further complications, so paying attention to unexplained weight loss may be the key to detecting liver disease before it's too late. 3. Jaundice. Yellowing of skin and eyes. Jaundice, or the yellowing of the skin and eyes, is one of the most recognizable signs of liver dysfunction, and often serves as an early warning that the liver is struggling to perform its essential functions. This condition occurs due to the buildup of bilirubin, a yellow pigment produced when the body breaks down old red blood cells. Under normal circumstances, the liver processes bilirubin by converting it into a form that can be excreted through bile into the intestines, where it is eventually eliminated from the body through stool. However, when the liver becomes damaged due to cirrhosis, hepatitis, excessive alcohol use, or fatty liver disease, it loses its ability to properly process and remove bilirubin. As a result, bilirubin levels begin to accumulate in the bloodstream, causing a yellow discoloration of the skin, eyes, and even mucous membrane. Jaundice is often one of the first noticeable signs that liver function is compromised, and while it may seem like a harmless skin change, it indicates that the body is struggling to eliminate toxins and process waste effectively. Aside from the visible yellowing of the skin and eyes, jaundice is often accompanied by other symptoms, such as dark-colored urine, pale stools, and intense itching, pruritus, due to bile salt deposits in the skin. These additional symptoms arise because bilirubin is not being properly excreted through bile, leading to waste buildup in the bloodstream. In healthy individuals, bile gives stool its characteristic brown color, but when bilirubin levels are abnormally high, stools may appear pale, clay-colored, or even white, signaling a serious problem with bile flow. At the same time, urine may turn dark amber or brown, as excess bilirubin is excreted through the kidneys rather than the intestines. The presence of jaundice often suggests significant liver dysfunction, meaning that cirrhosis, or another underlying liver disease, has progressed enough to impair normal liver processes. In some cases, jaundice can be painless and subtle at first, leading individuals to dismiss it as a minor skin discoloration rather than a symptom of a more serious condition. However, as liver damage worsens, jaundice can become more pronounced, and other complications, such as fluid buildup, ascites, mental confusion, hepatic encephalopathy, and severe fatigue may develop. Because jaundice is a key indicator of liver disease, it should never be ignored. If you or someone you know notices yellowing of the skin or eyes, especially when accompanied by other symptoms like fatigue, nausea, or abdominal pain, it is crucial to seek medical attention immediately. Blood tests can measure bilirubin levels and liver function, helping to determine the severity of liver damage. Early detection of jaundice can lead to timely intervention, lifestyle changes, and treatment options that may slow down or even reverse liver disease progression. 4. Swollen abdomen, ascites. Swelling in the abdomen, known as ascites, is a serious and often alarming sign of liver cirrhosis, indicating that the disease has progressed to a more advanced stage. Unlike regular bloating or weight gain, which may be temporary and linked to diet or digestion, ascites is caused by fluid accumulation in the peritoneal cavity, the space surrounding the abdominal organs. This occurs due to severe liver dysfunction, which disrupts normal blood flow and fluid regulation. The liver is responsible for producing albumin, a protein that helps maintain oncotic pressure, which keeps fluid within blood vessels. When the liver is damaged and unable to produce enough albumin, fluid begins to leak from the blood vessels and accumulate in the abdomen. Additionally, cirrhosis leads to increased pressure in the portal vein, the main vessel carrying blood from the digestive organs to the liver. This condition, known as portal hypertension, forces fluid out of blood vessels and into the abdominal cavity, leading to noticeable swelling. Over time, as the liver continues to deteriorate, the body struggles to eliminate excess sodium and water, further contributing to fluid buildup. Ascites differ significantly from regular bloating or weight gain in several ways. While bloating is typically caused by gas or digestive issues and may fluctuate throughout the day, ascites leads to a persistent, progressive swelling that does not go away with dietary changes or bowel movements. Unlike typical weight gain, which is associated with an increase in body fat, ascites is caused by fluid retention, often leading to rapid abdominal expansion within days or weeks rather than gradual weight increase over months. The abdomen may appear tense, stretched, or distended, and in severe cases, the fluid buildup can be so extreme that it causes difficulty breathing, loss of appetite, and discomfort when sitting or lying down. Additionally, individuals with ascites may notice swelling in the legs and ankles due to fluid imbalances, further distinguishing it from ordinary bloating. Another key sign of ascites is shifting dullness, a clinical test in which the fluid inside the abdomen moves when the person changes position, indicating the presence of free-floating liquid rather than gas. Because ascites is a clear indicator of liver failure, it should never be ignored. If left untreated, it can lead to serious complications such as spontaneous bacterial peritonitis, SBP, a life-threatening infection of the abdominal fluid. Medical treatments for ascites include diuretics, water pills to reduce fluid buildup, a low-sodium diet, and in severe cases, paracentesis, a procedure to drain excess fluid. However, addressing the underlying liver disease is the most critical step. If you or someone you know experiences unexplained abdominal swelling, discomfort, or rapid weight gain, it is crucial to seek immediate medical evaluation, as early detection and treatment can prevent severe complications and improve quality of life. 5. Swollen legs and ankles, edema. Swollen legs and ankles, also known as edema, are a common but often overlooked symptom of liver cirrhosis, signaling that the liver is failing to regulate fluid balance properly. This condition occurs when the liver's ability to produce albumin, a crucial protein responsible for maintaining oncotic pressure in the blood vessels, is impaired. Under normal circumstances, albumin helps keep fluid within the blood vessels, preventing it from leaking into surrounding tissues. However, as cirrhosis progresses, albumin production declines, leading to a loss of pressure within the circulatory system. As a result, fluid begins to leak out of blood vessels and accumulate in the lower extremities, particularly in the feet, ankles, and legs, where gravity naturally pulls fluids downward. In addition to low albumin levels, portal hypertension, a condition in which high blood pressure develops in the liver's portal vein due to scarring and obstruction, forces excess fluid out of the bloodstream, further contributing to edema. The kidneys also play a role, as liver dysfunction leads to sodium and water retention, making the swelling even worse. This buildup of fluid causes the legs and ankles to become puffy, swollen, and heavy, and in severe cases, the skin may become tight, shiny, and prone to indentation when pressed. Pitting edema. One of the reasons edema is often overlooked as a symptom of liver disease is that it can develop gradually and painlessly, making it easy to dismiss as a result of standing for long hours, aging, pregnancy, or other common conditions like heart or kidney disease. Many people may not recognize the connection between liver dysfunction and swollen legs, assuming it to be a minor circulation issue rather than a sign of serious organ failure. Additionally, mild swelling may come and go, leading individuals to delay seeking medical attention until the condition becomes severe. Unlike normal swelling, which may resolve with elevation, movement, or massage, edema caused by cirrhosis persists and worsens over time, sometimes becoming so extreme that it interferes with mobility and daily activities. The skin in affected areas may become fragile, prone to ulcers, and susceptible to infections, increasing the risk of complications. Because edema is a late-stage symptom of cirrhosis, its presence indicates that the liver is struggling to function properly, and immediate medical attention is required. Treatment focuses on managing fluid retention through low-sodium diets, diuretics, water pills, and lifestyle modifications, but the most important step is treating the underlying liver disease. If you or someone you know is experiencing persistent swelling in the legs and ankles, especially when accompanied by fatigue, jaundice, or unexplained weight loss, it is crucial to seek a medical evaluation as soon as possible to prevent further liver deterioration and serious complications. 6. Itchy skin, pruritus. Itchy skin or pruritus is a distressing and often frustrating symptom of liver cirrhosis, typically caused by the buildup of bile salts in the bloodstream. Under normal circumstances, the liver produces bile, which is essential for digesting fats and eliminating waste products, including bilirubin. However, when cirrhosis impairs liver function, bile flow becomes obstructed, leading to a condition known as cholestasis, where bile backs up into the liver instead of being excreted into the intestines. As a result, bile salts accumulate in the bloodstream and begin to deposit in the skin. These salts irritate the skin and activate the nerve endings, leading to intense itching, particularly on the palms, soles, arms, and legs. The itching associated with liver disease can range from mild discomfort to severe, persistent sensations that interfere with sleep and daily activities. One of the most bothersome aspects of pruritus is that it often worsens at night, when the body is in a more restful state. This is likely due to several factors. During sleep, circulation slows down, which can exacerbate the buildup of bile salts in the skin, intensifying the itching. Additionally, the absence of distractions or external stimuli at night may make the sensation more noticeable and unbearable. The lack of light and activity may also reduce the body's natural ability to distract from the sensation, making the itching feel more intense and overwhelming as bedtime approaches. For many individuals, itching becomes unbearable, leading to constant scratching which can damage the skin, causing redness, scarring, and open sores that are prone to infection. This continuous cycle of scratching and irritation may worsen the situation, making it harder to manage the discomfort. Despite its debilitating nature, pruritus is often misunderstood or ignored, as it can be mistakenly attributed to dry skin, allergies, or other less serious conditions. Unfortunately, this can lead to delays in seeking proper treatment for the underlying liver disease. Managing itching due to liver dysfunction can be challenging, and it often requires addressing the root cause. Improving liver function and reducing bile salt buildup. Doctors may recommend cholestyramine, a medication that binds to bile acids and helps reduce their circulation in the blood, or topical treatments such as moisturizing lotions, antihistamines, or corticosteroid creams to alleviate the itching. Additionally, some people find relief with cool baths or menthol-based lotions which help soothe the skin. However, the most effective solution for persistent pruritus is the management of liver disease, as treating the liver's underlying dysfunction can help prevent bile buildup and reduce or eliminate the itching over time. If you or someone you know is experiencing persistent itching, especially with yellowing skin, jaundice, fatigue, or abdominal swelling, it is critical to consult a healthcare provider to determine if liver disease is the underlying cause. 7. Easy bruising and bleeding. Easy bruising and prolonged bleeding are often overlooked symptoms of liver cirrhosis, yet they can provide significant insight into the liver's deteriorating function. The liver plays a critical role in the production of blood clotting proteins, such as prothrombin, fibrinogen, and various clotting factors. These proteins are essential for the blood to clot properly when a person sustains an injury or experiences a cut. When the liver becomes damaged by cirrhosis, its ability to produce these clotting factors diminishes significantly, leading to a reduced ability to form blood clots. As a result, individuals with cirrhosis may notice easy bruising, where even minor bumps or pressures cause visible bruises that are larger than normal and take much longer to heal. Additionally, people with cirrhosis often experience spontaneous bleeding, such as nosebleeds or bleeding gums, because their blood does not clot as efficiently. Bleeding gums in particular can occur during routine activities like brushing or flossing teeth, and it may go unnoticed at first, but can signal that the liver is no longer able to produce the necessary clotting factors to stop the bleeding. In addition to this, cirrhosis can also lead to platelet dysfunction, where the platelets, which help with clotting, do not function properly or are produced in insufficient amounts. This compounded deficiency of clotting proteins and platelets results in delayed healing of bruises and cuts, further exacerbating the problem. People with cirrhosis may notice that minor wounds take weeks to heal, while in severe cases, even a small injury can lead to significant blood loss. The combination of easy bruising, frequent nosebleeds, and slow wound healing is often a clear sign that the liver is no longer functioning at full capacity. This symptom is sometimes attributed to aging, medication side effects, or other blood disorders, delaying the diagnosis of liver cirrhosis. However, if you notice unexplained bruising or frequent bleeding, especially if combined with other liver symptoms such as fatigue, jaundice, or abdominal swelling, it is important to seek medical attention as soon as possible. Liver function tests can measure clotting ability and help determine if cirrhosis is affecting the liver's capacity to produce necessary clotting factors. Treatment often focuses on managing the underlying liver disease and, if necessary, administering clotting factor replacements or vitamin K to help improve blood clotting. Early intervention can help prevent severe complications, such as internal bleeding, and improve overall health outcomes. If you experience easy bruising, bleeding gums, or slow wound healing, don't delay. These could be signs that your liver needs attention before the damage becomes irreversible. 8. Dark urine and pale stools. Dark urine and pale stools are both important signs of liver dysfunction, and they can provide crucial insight into how the liver is processing bilirubin, a waste product created when red blood cells are broken down. Bilirubin is typically filtered by the liver and excreted in bile, which then helps digest fats and gives stool its normal brown color. However, when the liver is damaged, such as in cirrhosis, its ability to process and eliminate bilirubin is impaired, leading to the accumulation of this substance in the bloodstream. As bilirubin levels rise, the kidneys begin to filter out excess bilirubin, causing urine to darken, often to a deep amber or brown color. This darkening occurs because bilirubin is being excreted through the kidneys instead of being processed by the liver and excreted in the stool. Dark urine, therefore, is often one of the earliest indicators of liver problems, signaling that bilirubin buildup has reached a level that is no longer manageable by the liver. People with liver disease may also notice that their urine has a strong, unusual odor in addition to the dark color, further highlighting the need for medical attention. At the same time, the stool's color can also change significantly. In healthy individuals, the liver secretes bile, which contains bilirubin, into the intestines to help digest fat and give stool its characteristic brown color. However, when liver function is impaired, bile production can be reduced or completely blocked due to cirrhosis, bile duct obstruction, or other liver diseases. As a result, less bilirubin reaches the intestines, leading to pale or clay-colored stools. This lack of normal pigmentation indicates that bile is not being properly excreted, and the intestines are not receiving the digestive enzymes they need. Pale stools are a clear sign that bile flow has been compromised, and when seen in conjunction with dark urine, this often signals that liver damage has progressed significantly. In some cases, steatorrhea, or fatty stools, may also occur, which are bulky, foul-smelling stools that float, due to the inability of the body to properly absorb fats due to lack of bile. Both dark urine and pale stools are significant warning signs that liver damage may be occurring, and they warrant immediate investigation by a healthcare provider. These symptoms are commonly associated with jaundice, yellowing of the skin and eyes, another sign of liver dysfunction. and may suggest the need for liver function tests to evaluate the severity of the condition. Early detection of liver issues can help improve treatment outcomes, prevent further liver deterioration, and address underlying conditions like cirrhosis before they cause irreversible damage. If you notice persistent changes in urine or stool color, especially when combined with other symptoms like fatigue, jaundice, or abdominal pain, it is important to seek medical attention promptly. 9. Nausea and loss of appetite. Nausea and loss of appetite are common yet underestimated symptoms of liver cirrhosis, and they are often the result of toxins building up in the bloodstream due to the liver's impaired ability to filter and detoxify the body. Under normal conditions, the liver is responsible for metabolizing harmful substances, such as ammonia, which is produced when the body breaks down proteins. In a healthy liver, ammonia is converted into urea, a less toxic compound that is excreted through the kidneys. However, when cirrhosis damages the liver, its ability to process and eliminate these toxins becomes compromised. As a result, toxic substances like ammonia begin to accumulate in the blood, leading to a condition called hepatic encephalopathy, which can manifest as nausea, confusion, and a general feeling of being unwell. The buildup of these toxins affects the central nervous system, triggering the body's nausea reflex as a protective response to clear the harmful substances. This persistent nausea can significantly impact daily life, making it difficult for individuals with liver disease to eat or drink normally, further exacerbating the loss of appetite. In addition to nausea, the liver's inability to metabolize and detoxify also interferes with normal digestion. The feeling of fullness, bloating, and an overall loss of interest in food are common, and as the liver condition worsens, these symptoms become more pronounced. Loss of appetite is particularly problematic because it often leads to malnutrition and severe weight loss, which are dangerous consequences of liver cirrhosis. As the body becomes unable to absorb sufficient nutrients, including essential vitamins, minerals, and proteins, it begins to waste away muscle tissue and fat stores, further weakening the individual. The combination of nausea and a lack of desire to eat can make it extremely difficult for people with cirrhosis to maintain adequate caloric intake. In severe cases, this can result in significant weight loss, muscle wasting, sarcopenia, and a state of cachexia, where the body's ability to rebuild and maintain healthy tissue is severely compromised. Weight loss and cirrhosis can also worsen liver function, as the body's ability to repair itself becomes further limited. The loss of appetite is not only a symptom of liver disease, but also a vicious cycle, where reduced food intake leads to worsened nutritional status, which in turn impairs liver function even further. Treatment often focuses on managing nausea through medications that help reduce stomach irritation or alleviate nausea symptoms, as well as strategies to increase caloric intake, including small, frequent meals that are rich in protein and other essential nutrients. If you or someone you know is experiencing persistent nausea and loss of appetite, especially alongside other signs of liver damage like fatigue, jaundice, or abdominal swelling, it is critical to seek medical attention to address the underlying liver condition and prevent further complications. 10. Brain fog and confusion, hepatic encephalopathy. Brain fog and confusion, often referred to as hepatic encephalopathy, are serious cognitive symptoms that arise when liver dysfunction prevents the organ from efficiently detoxifying the bloodstream, leading to a buildup of toxins, particularly ammonia, in the brain. The liver is responsible for filtering out harmful substances, including ammonia, which is produced as a byproduct when the body breaks down protein. In a healthy liver, ammonia is converted into urea, a non-toxic substance, and excreted through the kidneys. However, when the liver is damaged by conditions like cirrhosis, its ability to perform this detoxification function diminishes. As a result, ammonia and other toxins accumulate in the bloodstream, ultimately reaching the brain and causing neurotoxic effects that impair cognitive function. One of the earliest signs of hepatic encephalopathy is brain fog, a term used to describe a state of mental confusion, difficulty concentrating, and a feeling of mental fatigue. Individuals may experience slower thinking, reduced clarity, and an inability to focus on tasks, making everyday activities more challenging. This early-stage cognitive decline is often subtle, but can progress rapidly if the liver's function continues to deteriorate. As the buildup of toxins in the brain becomes more pronounced, the mental confusion may worsen. In more severe cases, individuals may experience disorientation, memory loss, and difficulty recognizing familiar faces or surroundings. This stage of hepatic encephalopathy may involve more pronounced confusion, where people become incoherent, forgetful, or even unable to follow basic conversations. Another sign of worsening mental confusion is fluctuating levels of alertness, where individuals may experience periods of extreme drowsiness followed by agitation or restlessness. In some cases, hepatic encephalopathy can progress to delirium, where the individual becomes unaware of their surroundings, may experience hallucinations, or lose the ability to speak coherently. In the most severe cases, the confusion can lead to coma. These symptoms often worsen at night and may improve during the daytime as the body's natural rhythm and liver function fluctuate throughout the day. The cognitive decline associated with hepatic encephalopathy can be dangerous because it significantly impairs an individual's ability to care for themselves, make sound judgments, or perform daily activities. Treatment for hepatic encephalopathy generally focuses on reducing the accumulation of toxins in the blood by using medications like lactulose, which helps reduce ammonia levels, and antibiotics to reduce gut bacteria that produce ammonia. Managing the underlying liver disease is crucial to prevent further cognitive decline and improve quality of life. If you or someone you know is experiencing brain fog, confusion, or other signs of hepatic encephalopathy, it's essential to seek immediate medical attention. Early intervention can help prevent progression to severe mental deterioration and improve overall outcomes. 11. Red palms, palmar erythema. Red palms or palmar erythema are a striking physical sign of liver failure and can provide valuable insight into the underlying liver dysfunction. This condition is characterized by reddening of the palms, particularly the thenar and hypothenar eminences, the fleshy areas at the base of the thumb and pinky, and is often seen in individuals with cirrhosis or other severe liver diseases. The primary cause of palmar erythema lies in the liver's impaired ability to metabolize hormones, specifically estrogens, which are typically broken down and eliminated by a healthy liver. In the case of liver dysfunction, these hormones accumulate in the bloodstream and cause a dilation of small blood vessels, particularly in the skin. The result is the characteristic redness of the palms, which occurs because the dilated blood vessels allow more blood to flow to the skin's surface, giving the palms an unusually flushed appearance. This reddening is usually symmetrical, affecting both hands, and can also be seen in the fingertips and soles of the feet in some cases. In addition to blood vessel dilation, hormonal imbalances due to liver failure play a crucial role in the development of palmar erythema. The liver normally metabolizes hormones such as estrogen and testosterone to maintain a balance in the body. However, as the liver becomes damaged, its ability to metabolize estrogen is significantly reduced, leading to an accumulation of estrogen in the bloodstream. This excess of estrogen contributes to the vasodilation or widening of blood vessels seen in palmar erythema. Interestingly, men with cirrhosis may experience feminization effects, such as gynecomastia, breast enlargement, which are also attributed to the hormonal imbalance caused by liver failure. In women, the effect of estrogen excess can also result in irregular menstrual cycles or even cessation of menstruation due to the liver's failure to process the hormone effectively. While palmar erythema is most commonly associated with liver cirrhosis, it can also be seen in other liver diseases, such as hepatitis or non-alcoholic fatty liver disease, NAFLD, as well as in certain conditions that affect blood circulation or hormonal levels. However, when red palms appear in the context of other liver symptoms, such as fatigue, jaundice, and swelling, it serves as an important clue that liver function is severely compromised. The presence of palmar erythema in someone with liver disease often indicates advanced liver damage, and medical evaluation is crucial to determine the extent of the liver's impairment and to initiate appropriate treatment. While palmar erythema itself is not harmful, it is a visible indicator that the liver is struggling to function, and it underscores the importance of addressing the underlying liver condition to prevent further deterioration and manage symptoms effectively. 12. Bad breath. Fetor hepaticus. Bad breath, also known as fetor hepaticus, is a distinctive, musty, sweet odor that can occur in individuals with severe liver disease, particularly liver cirrhosis. This unusual breath odor is caused by the liver's inability to properly detoxify the body, leading to the buildup of ammonia and other volatile compounds in the bloodstream. Normally, the liver plays a critical role in filtering out ammonia, which is produced when the body breaks down protein. Under healthy conditions, ammonia is converted into urea and then excreted through the kidneys. However, when the liver becomes damaged by cirrhosis or other liver diseases, it loses its ability to process ammonia effectively. As a result, ammonia levels rise in the bloodstream, and it eventually escapes through the lungs, causing the characteristic musty, sweet-smelling breath. This breath odor is typically described as sweet or fruity and can resemble the smell of rotten fruit or mothballs due to the presence of ammonia and other byproducts of protein metabolism. The buildup of ammonia, a potent neurotoxin, is not only responsible for fetor hepaticus, but it can also contribute to cognitive impairment such as brain fog and confusion, hepatic encephalopathy, further indicating the severity of liver dysfunction. Fetor hepaticus is considered a clinical sign of advanced liver failure and is often a red flag that the liver is no longer able to perform its detoxification functions adequately. If you notice a persistent musty or sweet odor on the breath of someone with liver disease, it is essential to seek immediate medical attention to manage the underlying liver condition and prevent further complications.